So our next speaker is Dr. Alice McLarkin. Alice is a research associate in the Complexity Programme at the Social and Public Health Science Unit at the University of Glasgow, and coordinator for the fantastic TRIUMPH network, which stands for Transdisciplinary Research for the Improvement of Youth Mental Public Health. TRIUMPH brings together young people with academics, health practitioners, and policymakers to find new ways to improve youth mental health and wellbeing, especially amongst those where need is greatest. So I'll pass over to Alice now.
Okay, thanks Zoe, thanks for the introduction. So yeah, as Zoe said, so TRIUMPH is the Transdisciplinary Research for the Improvement of Youth Mental Public Health Network. We'll stick with TRIUMPH because that's a bit of a mouthful. So yeah, we have a focus on bringing together researchers, practitioners, policymakers and young people to find new ways to improve youth mental health and wellbeing, but specifically looking at that through a public health approach. So in terms of young people, we have a particular focus on those aged 10 to 24 in line with the WHO guidelines on young people and adolescents. So our public health approach really focuses on prevention and early intervention for mental ill health and promotion of good mental health and wellbeing, particularly looking on influence on through society, organisations, communities and individuals. So we don't have a particular focus on treating those with diagnosed conditions, but more earlier than that, looking particularly at prevention and promotion aspects. So the TRIUMPH network focuses on three core themes around which we focus all our activities, and our funding call was focused. So these are around schools and other education settings, which affect young people, social connections and relationships in their lives, and also looking at key groups of young people at the greatest risk of poor mental health. So we particularly focused on LGBTQ+ and care experience young people within those key groups, but we do recognise there are other key groups of young people, and the network also supports work with those. So for example, one of our funded projects is actually looking at ethnic minority groups of young people as well. So we really want to, as a network, better understand and address the key drivers of youth mental health and identify opportunities and challenges through research collaborations that can strengthen the evidence base around effective and sustainable interventions. And a key thing, part of what we do with TRIUMPH, is we try to put young people at the heart of everything we do. So it's a key principle of the network that effective intervention research should really include all of our different stakeholders group, but particularly young people themselves. So in terms of the Plus funding call for our network, so we hosted our funding call earlier this year, so it closed in July and we announced our successful projects in September. TRIUMPH are only going to be launching one funding call, so there won't be future opportunities for funding through the network, specifically for research, but I was going to share some of the feedback from our reviewers, which will hopefully help you if you're applying to other funders in the future. So our funding call focused specifically on interventions to improve young people's mental health. So rather than looking at kind of primary research or analysis of data sets and things, we were looking specifically at intervention research and supporting small scale research projects or scoping work that had a potential pathway to impact and to getting further funding for intervention development work. So key requirements of our funding call were that, as with the other networks, it was the involvement of transdisciplinary teams, so those from policy and practice and young people themselves. So it was quite a high bar to reach in terms of bringing together that research group, and particularly around young people's involvement. So we were expecting to see young people involved in the research team as well as participants in the project. So as I said, so the call closed in July and we received 34 applications, and of those we funded 4 projects. So 2 of those were led by ECRs, and I think you're hearing from one of our ECR leads later on today. And the other 2 projects involved ECRs within the team who were leading specific aspects of the project. So perhaps they were leading on the qualitative work for a project, or they were leading on the youth engagement side of it. But they really had clearly defined roles within those projects that they would be leading on. So in terms of the review process for our funding call, similar to the Emerging Minds Network, we had quite a mixed review panel. Again, another challenge for ECRs is meeting the needs of all those people. So we had a professional review panel which included 6 members from our network management group, which are researchers in youth mental health from across the UK. But also 6 reviewers, external reviewers from policy, practice and research. So we had representatives from organisations like McPin, Barnardo's and the Scottish Government reviewing as well, to think about what is the impact of these interventions in the real world. And then on top of that, we also had a young people's review panel. So this was made up of 12 young people who reviewed the applications, who were aged 16 to 24 and are part of our network youth advisory group. They really brought a slightly different perspective on the applications, really thinking about, are they of interest to young people? Are they relevant to young people's lives? And are people's plans for involving young people within the research actually realistic and engaging? And I suppose in terms of things for you to take forward, that's one thing I really wanted to focus on today. So I've got a couple of slides which I can hopefully share just now. Hopefully that is now sharing. So as part of the review process, I said we had 12 young people who reviewed the applications, and we had a review panel meeting. And before we even got into discussing individual applications, we just wanted to find out from the young people what makes application about mental health really stand out to you, and what are the things that just turn you off. So we had a little poll on Mentimeter, and this is literally some of their responses straight from Mentimeter. And I think it's really important, particularly if you're working with young people, and I saw in the chat a lot of you do have quite a big focus on young people and children's mental health. Because even if they're not reviewing your funding application, one of the things one of our professional reviewers pointed out is that actually if young people are engaged with an idea, for example in the funding application, they're going to be engaged with the project. They're going to want to be involved in that project and take part, fill in your survey, be involved in workshops and things. So it's really important to make sure that your research is speaking to what's important to them. So in terms of what our youth advisors really liked about proposals, they liked ones that had a clear background. They really understood where the research was coming from. They liked it to be clearly stated about what the project was for and about how young people would be involved in the project, what would be the expectations of them, how would they be reimbursed, what would be the benefits to them. They liked concrete plans for scaling up the project. So a big focus of our funding call was on that future plans about where would you get more funding from, or what's the impact in the future. And young people really wanted to see that message of how's this going to lead to something else. And they also said quite a lot about how it's written. I think even our professional reviewers said this: if your application is easy to read and easy to understand, it's a lot easier to review. And I think that comes back to a point that Sian raised earlier about making sure you're getting some peer review of your application, you're getting other people to read it before you submit it. In terms of things that young people pointed out that they perhaps didn't like so much about a proposal, some were quite repetitive, and there were some which were just the same old projects. And I think they really wanted to see something new and innovative that was different to what is already available. They also commented quite a lot about impact. And I think young people, and again, our professional reviewers who were non-academics, so from policy and practice, really wanted to know about how is this research going to have impact in the real world? How is it going to improve young people's mental health? They didn't just want to see research for research's sake, they want to see how that's going to improve young people's lives. Other things that they commented on were, making sure that research is something that's also a priority for young people and not just for researchers. And again, just about how it was written. So some said some projects were just hard to understand or quite vague, or there wasn't enough information about how young people would be involved. So I think I'll stop sharing there. But I think, interestingly, that kind of summarised a lot of the comments that came from our professional reviewers as well. But it's just something useful to think about when pulling together your application about actually how would young people involved in the project see this project as well. In terms of other top tips that we have based on the feedback on our applications, I think one of the key things is thinking about the scope of the funding call and just making sure that you're really addressing that with your project. So we had quite a strong focus on intervention development. And we got some really interesting applications, but they didn't necessarily show what that pathway to an intervention to improve mental health was. It was still quite basic research. So just think about, it might be a great project idea, but does it really meet the funding call? Because otherwise you're putting in a lot of work for something which is unlikely to be successful. As I've already mentioned, yeah, there's a big focus on impact, I think. I think it's really important to have a good narrative within any applications that you put together about how your research is going to have impact in the real world. How is it actually going to improve mental health eventually? And as an ECR, and particularly with, I think, some of the funding calls from the networks, we're funding quite small scale projects, so it might be quite early work that you're putting in, but as long as you've thought ahead about, okay, so what will this lead to? How could I get further funding in the future which will allow me to develop this? So it's not necessarily that it has to be impact from your project, but it's how that could lead on to something bigger, I think was quite important to our reviewers. And linked to that—
You've got 1 minute, sorry.
Oh, sorry, I'm going again. Yeah, and finally just say, and linked to that is thinking about who you want to involve in your research team. Because I think one of the barriers to really scaling up research projects, particularly ones that you want to have impact, is making sure you've got the right policymakers and practitioners and people involved from the start, who can help you scale up and share outputs from your research across their networks within the real world. So that was one thing we were really keen to see, was that actually policymakers and practitioners were also involved in the funding applications. And it's just really important to involve them from quite early on in the project as well. And I'll just briefly say, so in terms of other opportunities coming up through the network, so we don't have specific ECR events coming up, but we do have some training opportunities that will be coming up in the new year. One will be particularly around co-producing research with young people. And there will also be some training around intervention development. So if you keep an eye on the Triumph website and also on our newsletter, which you can sign up to through the website, you'll be able to hear about those as well. And I'll stop there, Zoe, so I don't run over.